Today we're going to spend some time talking about overcoming and managing obsessive compulsive disorder, or OCD. My name is Dr. Patrick McGrath. I'm the Chief Clinical Officer for NOCD. You may have seen our Get to Know OCD podcasts, and if you like the content that we do, well, go to our NOCD YouTube channel and subscribe, or get it wherever you get your podcasts. Today, we're going to take a break from the longer form of that and talk about some more educational work. And I'm excited to talk about things that are really good for people with OCD to do and incorporate in their lives, and also maybe dispel a few myths along the way. Now, there are some really great scientifically proven evidence-based treatments for obsessive compulsive disorder. The first ones are exposure and response prevention therapy that we want to talk about, and then there's also medication management. Along with those things, there are some lifestyle habits that people can do and incorporate in their lives that could help along the way. So what is exposure and response prevention therapy? Well, it's really two things. Exposure, or the E of ERP, is purposely exposing yourself to the thoughts and the images and the urges that happen as part of OCD. Those thoughts, images, and urges that people may find to be intrusive, unwanted, or inappropriate, however you may describe them, that cause you some kind of anxiety or distress or maybe shame or guilt or disgust or discomfort, those are obsessions. Those are things that we think, I probably shouldn't be having that. That needs to go away. I'd like to maybe do something to neutralize it, and that's where a compulsion comes in. A compulsion is a mental act or a physical behavior that we do as a way to try to manage obsessive compulsive disorder, and we think that by doing those, it will stop the obsession from happening. Yet, it's not a permanent stop, because if you have OCD, you know that the relief is temporary, and then the obsession starts to sink back in and the process starts all over again. And now we have to do the thing over and over and over. And OCD can be a real jerk, as you probably know already living with it, where it tempts you by saying, oh, you were so close, you almost got there. Why don't you just try it one more time? But as you'll learn, once is never enough. You'll always need to do more. So with exposure and response prevention therapy, by having people face their fears and learning that they can handle them, it isn't learning that they won't happen or that your compulsions are great to do or anything of that nature. We actually want to eliminate compulsions. We want to get people to not do them. That's the response prevention piece. So we're purposely stopping the typical response that people have in relation to the obsessions that are occurring. So by doing exposure and response prevention, we're allowing for the obsession, but we're not allowing for the compulsion. To support this, there are things that people can do. You should get great sleep. It's really helpful. We know that it's a mood enhancer by getting really good sleep. And that's harder and harder these days when people go to bed and there's a TV maybe in the bedroom and there's a couple of screens that they have access to right in the bed. And I always say, get all of those away from the bed. Beds are for sleeping, and if you're an adult, maybe some other things as well. But that's really what beds are for. You want to be able to sleep in there and not get caught up in researching, which OCD would like you to do. You want to only be sleeping in there, right? So get good sleep. Also, exercise. Exercise releases chemicals in the brain that are similar to some medications and lead you to feel better potentially over time. Of course, if you're just starting off on medication, it's great to consult someone who works in the physical world, like a general practitioner or maybe a trainer who can help you get on a good program. But know that in starting medication, it's not going to feel great when you start it. In fact, it's probably going to be rather uncomfortable. But guess what? That's going to happen when you start exposure and response prevention therapy, because it is uncomfortable. You're no longer doing what OCD wants. You're doing the opposite. And when you do that, OCD is going to throw a tantrum. It's going to be a kid in a candy store demanding candy, and you're not going to give it to it. You're going to finally say, you know what, OCD? You have taken so much from my life. It's time for me to take things from you. And the one thing you can take from OCD is doing compulsions. So that's what you're really going to be working on. If along the way you find that ERP isn't quite giving you everything you want, medication is another thing that can be added to help supplement the work that gets done for the treatment. And there are really great medications out there. Most likely you'll start on an antidepressant, one that we call an SSRI, or a serotonin selective reuptake inhibitor, or maybe an SNRI, which are bringing in other neurotransmitters there too, like norepinephrine. Typically, the dosage that one needs of these medications is higher than the dosage that people who aren't specialized in treating OCD are comfortable with. So if you just go to your general practitioner for medications, they may prescribe some of these drugs for you, but you might not get the effect out of it that you were looking for. This, therefore, says it's important to really seek out a professional, not only to get exposure and response prevention therapy, again, the evidence-based treatment for OCD, but also to be sure that you're getting the right dosage of medications if that becomes a part of your treatment regimen. And there are things above the SSRIs too. You can also utilize certain other classes of drugs like tricyclic antidepressants. Most of the time doctors don't start with those because they attack several neurotransmitters and kind of work on those, but they can have more side effects. If people are really stuck in some of their obsessions and have a very low level of insight into the OCD, there are even low doses of atypical antipsychotics that can be helpful. Now, I know that antipsychotic word can sound very scary for a lot of people, but at low doses, these medications can help break some of the hold that the obsessions have on people and maybe crack the door open a bit for people to be willing to try to do some exposure and response prevention therapy exercises. We also have various levels of treatment available. The outpatient is the typical thing that most people are familiar with for therapy, but there's also intensive outpatient, which can be 3 hours a day for 4 or 5 days a week, partial hospital programs, which are 6 hours a day, usually for 5 days a week. And then there's even residential treatment where you would go and actually live somewhere and do treatment 24/7 for a month to up to 3 months of time. All of that comes with a team of people who are there to help you, to talk with you, not only again about ERP and medication, but some of those lifestyle things we were talking about. They may help to set curfews so that you get some good sleep. They'll serve meals that are hopefully healthy. They'll likely have a gym available so that you can do some workout. And they'll bring other things into your life that maybe you have stepped away from, like art and music, and maybe even teach things like meditation or mindfulness. These are great adjuncts that people can utilize in the treatment along with ERP to help them really focus in on the work that they're doing and not get distracted away. OCD would love you to be distracted. OCD would love you to focus on anything other than the exposure and response prevention therapy that you need to be focusing on. And there's even a therapy called ACT, or acceptance and commitment therapy, which, and a good friend of mine, Michael Tuig, does a lot of research on, is a wonderful adjunct to the work that you can do with exposure and response prevention therapy. But even he would say that is not the treatment for OCD. That is a great adjunctive treatment for ERP. Bringing in friends and family to be supportive is also really important. Unfortunately, friends and family can fall into safety behavior work. OCD is very manipulative and will try to get friends and family to do all sorts of safety behaviors, like helping you to avoid things that you're afraid of, giving you a lot of reassurance that you'll be fine and everything will be okay, and even helping you to distract yourself so that you don't have to pay attention to things that are uncomfortable. They may even supply you drugs or alcohol or other types of substances as a way to help distract you from some of the obsessions that you're experiencing. And they may actually become a part of some of the compulsions that you're doing. Great therapy will involve helping them to step away from those safety behaviors, because it turns out those safety behaviors only maintain OCD. They don't help to get rid of it. Even though they may feel good in the moment, in the long run, they're growing the obsessive compulsive disorder instead of shrinking it. Now, there's other treatments out there that aren't so great for OCD. A general talk therapy is probably not going to be very helpful for OCD because the likelihood is a general talk therapist will get into debates with people who have OCD, trying to show them how irrational the things are that are going on in their life. The issue here is that those conversations have likely been had with all sorts of friends and family members already, and now it's just being rehashed with a therapist. I don't want to argue with OCD. You know why? I will lose the argument. And I've been treating OCD for 25 years. You'd think at this point in my life, maybe I'd figure out how to win an argument with OCD. But no, I can't win an argument with OCD. It's unwinnable because OCD doesn't use the type of logic that people without OCD use. OCD has a logic that has one extra yeah, but what if added to it than anyone else will ever be able to challenge. So no matter what great answer I might give to somebody who has OCD, they will come up with a, yeah, but what if this, as a rebuttal to it. And there comes a point where I just won't have any more answers to those rebuttals. And then the person with OCD will say, see, what about that? Now that I know that that's out there, that's a possibility, well, now I have to worry about that. In OCD, what happens? Possibility equals probability. What that means is that if I find something to be possible, I believe it to be highly probable, and therefore I best do something about it to make sure that nothing bad happens. Because again, if I don't do the thing to neutralize it, and then the bad thing does occur, it is my fault. Other treatments may also say, take these supplements or do all of these things. They just haven't been researched, really. There isn't FDA approval. There isn't a lot of scientific evidence for these things. But there is a lot of research going on. So that is the good sign about it. Things are coming down the line, and I'll be very interested to see where the field goes in the next decade. Will there be supplements that we find that could be very helpful for OCD? Will there be genetic breakthroughs that we'll see? Will there be new classes of medications that might be helpful for OCD? And might there even be enhancements to exposure and response prevention therapy, like virtual reality usage, that could really take ERP to the next level and help those with OCD who are really stuck? It's an exciting time. And to just think that ERP, or exposure and response prevention therapy for OCD, started in 1966, 1967. We are still very young in this field. There's a lot to still learn, but there's some amazing people out there doing incredible work to assure that people with OCD are going to get the help that they need. Are we perfect at it yet? Nope. Are we trying to be? No. Because perfect's impossible, and we wouldn't want to do that. We don't want people with OCD to try to be perfect. We're not going to try to be perfect either, but we're going to try to be really darn good at this. And that's going to be our goal, to do the best that we possibly can to give the community of people with OCD the most help that they could possibly receive. If you're looking for help with OCD, I encourage you to check us out at NOCD.com. You can set up a free 15-minute appointment with our intake department, and they would be glad to chat with you about how exposure and response prevention therapy through NOCD might be helpful for you. We have trained therapists throughout the country in all 50 states who are licensed and ready to help do the work with you to get ERP to be a part of your life and for you to live the life that you want to live and not the life that OCD wants you to live. Thanks for your time today. I'll see you again.